Thank you everybody for joining us today. My name's Jess Beagley. I'm the policy lead with the Global Climate and Health Alliance, and we're here to talk about the fact that there can be no health without adaptation finance. 18 months ago at COP29, governments agreed to the new collective quantified goal, a target of $300 billion of climate finance by 2035 to support climate action in developing countries, less than a quarter of the estimated need. As we're seeing for climate finance overall, finance for adaptation falls dangerously short of the levels needed. UNEP projects that by 2035, the level of adaptation finance required in developing countries will reach somewhere between $310 and $365 billion annually. Adaptation finance actually fell from $28 billion in 2022 to $26 billion in 2023. At COP30, governments agreed to triple previous target levels of adaptation finance by 2035, but developed countries have failed to recognize that commitment here this week. Reaching targets for adaptation finance across all sectors, agriculture, water, infrastructure, and beyond, is nothing less than a health imperative. Without it, populations will be left without access to nutritious food, drinkable water, safe homes, reliable energy, or basic healthcare services. The quality of adaptation finance, in addition to the quantity of it, is also a vital issue for the health of people. When finance is based on loans rather than on grants, this reinforces cycles of debt, poverty, and disease. The Bridgetown Initiative tells us that the poorest countries in the world currently spend more on debt service than they do on healthcare, education, and infrastructure combined. We've heard repeatedly this week that even where finance does exist, it can take years and great capacity costs for governments to access it. Well-designed adaptation interventions that protect health and lives are investments with returns on health and well-being extending beyond what can be captured towards short-term financial measures, even as increases in productivity and avoided healthcare expenditure offer a financial bottom line. Health itself is also a pillar of adaptation, with healthy communities being more resilient to climate shocks. Having set that context, I refer to our panel. I will turn to our panel. Our final panelist will join us partway through the session, but I'll introduce everybody now. So first, Niona Nakuya Kasekende, Program Manager with Regenerate Africa, will share realities and experiences from Uganda and East Africa. Then Tara Daniel, Associate Director of Policy with the Women's Environment and Development Organization, will give an overview of the current state of adaptation finance and the extent to which this delivers for health. Dr. Sidi Moctar, Adaptation Negotiator for Mauritania and least developed countries, will provide the latest updates on negotiations here this week and the priorities of least developed countries. And finally, Pooja Dave, when she arrives, Policy Coordinator with Climate Action Network, will reflect on the need to link justice for communities with the decisions taken here in these halls this week. Without further ado, I'll pass over to Niona.
Thank you very much, Jess. Allow me to start by sharing a conversation that has stayed with me for a very long time. During our research in Beagley district that's located along the shores of Lake Victoria in the East African region, we sat with communities and asked them a simple question: what has changed? And one woman said something that I have never forgotten. When men cannot be breadwinners as they are expected to be, they become stressed and the stress comes home with them. She was not talking about economics. She was talking about her body. She was talking about what happens when a flood takes the harvest. The fishing boat stays docked because the lake is too dangerous, and a man's sense of self collapses alongside his income. She was describing a pathway that between climate shock to intimate partner violence, told in a single sentence by a woman that had lived it. Climate change is not an environmental issue that occasionally touches health. It is a health crisis that moves through every dimension of a woman's life: her safety, her body, her ability to carry and deliver a child, her access to care, and her right to make decisions about her own future. The communities we spoke to in the Lake Victoria Basin described a world that is coming apart at multiple seams simultaneously. The rains are erratic and increasing violently. When they come too hard and too fast, they flood the roads, the same roads that connect a pregnant woman to care that is already 10 to 15 kilometers away. In 2019, they destroyed a health facility. 2020, the same story. 2023, repeated, and 2024 again. And communities around these facilities lack limited access to life-saving medical services, not because the health system has abandoned its people, but because buildings are gone, roads are impassable, and supply chains are collapsed under the water. But the health crisis does not begin with the flood. It begins months before. It begins in the field. When the food runs out, people don't simply go hungry. They make devastating calculations. Young girls are withdrawn from school. They are married off earlier because the bride price eases the pressure. One less mouth to feed feels like sincere survival. The women in our focus groups describe this not as a choice, but as arithmetic. The arithmetic of a household that climate change has already bankrupted. And we know where early marriage leads. Early pregnancies, bodies not yet ready for childbirth, to high rates of obstetric complications, and to maternal deaths that are recorded in health registries, with no mention of the drought or flood that set them in motion. And malaria is there as well, a climate-sensitive vector-borne disease that is ravaging developing countries like Uganda. In Uganda's highland communities, this disease was barely known, but right now it has tripled, not even tripled, but quadrupled from 3 to 12% in just a decade, from 2010 to 2020. Warmer temperatures have extended the mosquitoes' range, and stagnant waters have multiplied its breeding grounds, and pregnant women whose immune systems are already compromised face disproportionate risk, higher risks of miscarriage, stillbirths, and delivering babies too small and too fragile to survive. These are the reasons as to why we are integrating health in climate policies and plans in Uganda and in other African countries around the globe. The language on gendered health impacts of climate change is there. The commitments are felt and are recorded, but the finance has not followed. But acknowledgement without finance is not protection. It is documentation of a problem that we have decided not to solve. What our research taught us is that we cannot separate a woman's health from her food security, her safety, her energy access, her housing, or the road that connects her to care. These are not parallel issues. These are the same issue wearing different faces on different days of the same climate shock. So when we talk about health protecting adaptation finance, we must be honest. Allocating more money to the health sector is not necessary, is a necessary thing, but it is not sufficient enough. So adaptation finance must flow across every sector that determines whether a woman arrives at a health facility at all. It must be public, grant-based, not debt that countries already spending more on debt service than healthcare will repay instead of rebuilding climate-resilient health infrastructure and systems. It must be gender-responsive, reaching women like those our research spoke to directly. And it must come fast enough to matter to communities that do not have the luxury of waiting for the next COP or the next SBI. We are here to talk about what these women of Buikwe district and others who bear the same impact in their daily lives go through, and we're all the way here into decisions that determine whether adaptation finance is tripled, protected, and is delivered in ways that actually reach them. This is because they deserve nothing less. Thank you.
Thank you so much, Niona, and I couldn't imagine a more grounding start to this discussion or a connection of what happens here this week in Bonn to the communities that will see the outcomes of these negotiations in their lives. I'll pass now to Tara.
As Niona has so clearly demonstrated, considering the state of adaptation finance also means considering what happens when it isn't provided. Failing to provide adaptation finance means exposing communities and individuals, particularly those most marginalized, so often women, girls, and gender-diverse people, to the ever-escalating impacts of climate change. These impacts are not mere inconvenience, but a denial of human rights. The right to education, to be able to both travel to school and to have a safe school with adequate infrastructure for menstrual hygiene. The right to health, including the ability to access sexual and reproductive health services, from prenatal care to the detection of gender-based violence to contraceptive counseling, among many others. Rights are resilience, and gender-responsive adaptation finance protects and upholds sexual and reproductive health and rights as part of the right to health. That's why it's so dangerous that in this first year of implementation of the Belém Gender Action Plan, which recognizes health, violence against women, and care as relevant issues, and during this year of implementation of the new collective quantified goal, and following the COP30 decision on tripling adaptation finance, that developed country parties are failing to fund adaptation. Developed country parties are failing to recognize the imperative for adaptation finance, failing to honor their own commitments, and failing to act on the long-standing recognized interlinkages between gender and climate change. Over a decade into gender and climate change being its own agenda item, there's an inherent dissonance in promoting gender equality and climate justice without providing adaptation finance. We know this to be true as we see the provision of adaptation finance to developing countries standing at only $26 billion in 2023, well less than even 10% of what is needed. We also see this truth in the drastic lack of support for the Adaptation Fund, which provides grant-based climate finance and has an intersectional gender policy. For the past 3 years, pledges to the Adaptation Fund have fallen short of the minimum amount required for this fund to deliver the climate action that countries need. Pledges at COP30 were only $135 million against a resource mobilization floor of $300 million and a project pipeline of $1 billion. We have not even reached the floor, we are underground. The support from only 11 contributors demonstrates a total abdication of responsibility when it comes to the legal obligation to provide climate finance, affirmed by last year's International Court of Justice Climate Change Advisory Opinion, and it's a betrayal of the new collective quantified goals goal to triple outflows from the UNFCCC-linked multilateral climate funds, such as the Adaptation Fund. This betrayal affects the health, well-being, and lives of women, girls, and gender-diverse people who are particularly bearing the burden of the developed countries' continued inaction. The failure to provide adaptation finance undermines not only the NCQG, but also the Climate Finance Work Program discussed here in Bonn, as well as the Paris Agreement and the Convention, where adaptation and adaptation finance are inherent to achieving the objectives and protecting and upholding human rights. The lives and the well-being of communities merit the fulfillment of existing commitments on health, on gender, and on the fundamental enabler of action, climate finance.
Thank you so much, Tara, for painting that picture and giving us that overview after years of following this work. I'll pass now to Dr. Moctar.
Thank you so much, and happy to see you all, and thanks for the insights shared by the colleagues here. And to reflect first on the point of health, as one of these health professionals trying to bridge the work between climate and health in this process, I can tell you that like most vulnerabilities assessment and research are saying that that health is one of the biggest priorities and vulnerabilities to our world, especially for LDCs in this space. But I think we don't really need articles and read academia to understand this. Because a parent, for example, in Kobani, Mauritania, whose child is suffering from hemorrhagic fever, a disease that comes with the changing climate patterns they didn't know before, and knows this reality. And a family watching a young girl struggle with asthma due to air pollution knows this. And a mother who lost her very weighted baby because heat stress triggered preeclampsia during her pregnancy knows this in the most devastating way possible. So people can see and touch the health effects of climate change, and this is not abstract. And countries did mention this as a priority, as 87 of NAPs, 90% of NDCs mention health as a priority. So what we're lacking here is not a prioritization by countries, nor by evidence, nor by vulnerabilities and events happening on the ground. The most alerting reality is that less than 1% of global finance goes to health. And I don't have the percentage of the number of climate finance, but we know it's not too much because we're not bringing this discussion to these rooms yet. No health without adaptation finance. We understand the co-benefits of mitigation efforts and that it's streamlined along all the topics in these rooms. But we think that dealing with health is financing adaptation. And this is a priority for LDCs. We also see, to some hope, we see a real advancement in putting health in the space, as we know in the GGA targets and indicators for now. And we have even health in other targets and indicators, not just the health target, but we still have so much to do more. And indicators are really important to measure our way forward towards this, the global goal on adaptation and how we're doing. But the most important part is to implement for now. And we have been saying this for long, and this time is for implementation, and the next one is for implementation. But implementation needs means of implementation, talking primarily about finance, capacity building, and technology transfer. As a matter of negotiations, we are progressing on the adaptation matters, on the Nairobi Work Program specifically, but we have a serious concern that some parties are still not adequately recognizing the specific needs and circumstances of LDCs, and we think that this is a priority for, from our room of negotiation. On the GGA, we are working now on advancing the work that we started after the adoption of indicators in Belém towards indicator coherence in the adaptation architecture, but implementation specifically. And coming out of Belém, amid all the concern that we had with the adaptation indicators, there was one glimmer of hope that we secured the tripling of adaptation finance. It wasn't the timeline we wanted. We were asking for 2030, but it was a signal that money could flow for adaptation. You would assume that having agreed on one of the most important outcomes of COP30, we would come here to discuss how to make it happen. Instead, and I think this will shock you, halfway through week 2, there is still no explicit mention of tripling anywhere in any text. From day one of this negotiation, the tripling was flagged by the G77 as a key element that needed to be reflected in the GGA text. Some groups even came with concrete proposals on how to take this forward. 2 iterations now, and it's nowhere to be found. We can't even spell it out. So something that was born in the GGA room, and we can't talk about it in the GGA room. People assume always that we come to negotiations every year to ask for money. And that is not what it is. We have already agreed to triple, and we are asking for discussion on how we are delivering on this, how to get there, and accountability to ensure that we do, even that apparently is, for the moment, too much to ask. It's deeply concerning and disappointing that this process cannot even signal hope to the most vulnerable countries, the LDC group. We will stand firmly on this, and this call for tripling came from our group, in the GGA room. We championed it, and we'll not leave here without advancing on it and understanding where it will live in this process. So I'll conclude by this, as I started by the health concern. I think bringing health and talking about health vulnerabilities in this system is really necessary to make this process, UNFCCC process, a healthy process. I thank you.
Thank you, Dr. Moctar, and that's going to stick with us. The issue here is not a lack of prioritization or a lack of planning, but the failure of developed countries to remember their own commitment here this week. We'll pass now to our final speaker, who comes to us straight from the GGA room. Over to you, Pooja.
Thank you so much. And apologies for the delay. We had to deliver a really strong statement in the GGA room, exactly calling for tripling. And it is very unfortunate that while we fought so hard for getting that tripling in the outcome from COP30, yet the text over here cannot even mention it. So with that, I just want to say, adaptation has been limited to technical jargons. It has been talked about indicators, framework, target, but that is not the reality on the ground. The reality on the ground is that adaptation is about if a person can live a healthy life. Adaptation is about that when there is a heat wave, if a child is feeling protected. Adaptation is about that when a flood hits a region, a pregnant woman has access to clean drinking water. Adaptation is about when daily wage laborers are out there working in the scorching heat under a heat wave, they are feeling protected and have means to build their resilience. And adaptation is all about that. And that is why adaptation is also about public health. And both of this, adaptation and health, which are two sides of the same coin, cannot happen without finance. Global goal on adaptation and plans will not deliver adaptation on ground. It will be only a healthy, resilient communities that will. What will those indicators measure when there is no money to implement those adaptation plans on the ground? What will the labor eat when they have no way to go out in the sun and do their work? This is all about justice and rights. It is about how public finance is provided where it is needed. Adaptation is not a charity. Adaptation is not about investment. Adaptation is about public, grant-based, predictable, directly available finance to implement those plans, to implement those targets that we have been talking about in Global Goal on Adaptation, and to make adaptation real on ground. It is about us. It is about the real world challenges, and it is about all those people who are facing the harsh impact of climate change. Yes, the Global Goal on Adaptation is for everyone. But before you say those words in the room, ask yourself if any least developed countries or developing countries, any countries in Africa or South Asia, by its own means, have the ability to build their adaptation. No, they don't. They have structural barriers. They have limitation, and that is why we call that the tripling of adaptation finance by 2035, which was agreed at COP30, a commitment which you made to us. You finally deliver on this commitment. While over here, you are even shying away from mentioning the word tripling. And the fact is that tripling is merely 120. When we as CAN was supporting the call for tripling on the line what LDC had been demanding, our tripling was 120 billion per year by 2030 and not by 2035. By extending the timeline to 2035, you are further reducing the finance that will be made available. By not giving clear baseline, it is difficult for us to assess that. So no longer tripling. While it should be mentioned, we want a quantitative number out there on finance, which is 120 billion. We don't want talk shop. We don't want technicalities. We want real means of implementation in form of finance, capacity building, technology transfer, flowing from developed countries to developing countries to ensure that we all can live with pride, dignity, and for our well-being, because that is the only thing that we have been asking for our survival. So one last point, adaptation is not charity. It is for our survival. And please provide adaptation finance, because when you will provide adaptation finance, you will ensure we have a healthy environment around us and we have access to health. We have access to clean drinking water and we have access to food. All that builds our resilience for the future and for the future generation.
Thank you, Pooja, for bringing us to such a powerful close and for bringing all of the speakers together despite not being in the room when they were speaking. I'll open now for questions. We've got about 5 minutes. It's also possible that there is not much need for questions because I think our panelists were phenomenally clear in what is needed.
The message was very clear, I guess.
One question at the back. Thank you.
I came in kind of late. Can you guys, each of you, give just a one-sentence summary of what your message is?
Sure. Communities need to be considered in these conversations. The impacts of climate change on their health and on the disproportionate impact on their gender needs to be considered in these conversations. We have the evidence and it's there and available. And at the end of the day, right now we're asking for the finance to implement what has already been discovered. So the tripling is hence the conversation that's going to be further elaborated on, I think, with other speakers.
Similarly, we have these existing commitments and this existing evidence and acknowledgement of the linkages between health and climate change, the linkages between gender and climate change. And what we are asking for now is for developed country parties to deliver on their existing commitments on health, on gender, and on climate finance when it comes to adaptation finance, including by sending a very strong signal by fully funding the Adaptation Fund this year, which has been sacrificed for many years and shows the lack of prioritization of rights-based climate action.
Health is also important in this process, and it's time for adaptation implementation, and implementation relies on the means of implementations, finance, capacity building, and technology transfer. And we had a commitment from CMA 7 that we are tripling adaptation even farther, like more than the time framework that we asked for, but at least that was a good signal. But we are very shocked that we are like nearly the end of the second week, and we can't even mention that in the GGA text. And we have asked for this, and the G77 asked for it. And we had 2 iterations of the text, and until now, no mention for that. And we're really concerned about that. Second, vulnerabilities of LDCs and SIDS are in the Paris Agreement, and so we can't also understand resistance to further referencing these vulnerabilities in any other text. Thank you.
My only last message will be tripling, tripling, and tripling. No false commitment, urgent and full delivery of tripling adaptation finance, and we are not leaving Bonn without that.
Thank you so much, everybody. And I think that is all for today. Thank you to our panelists, and thank you to you for coming.